Exercises before and after a lingual frenectomy are very important for a successful outcome. These exercises help increase range of motion, thin out the skin, push back nerves and blood vessels. Hopefully, this means the practitioner will be able to safely cut more tissue and increase your chance of a successful outcome. Ideally, exercises would be custom designed for your case by a myofascial therapist. However, if no therapist is available, or if you just want ideas for new exercises, then hopefully these, my favorite exercises for pre-op, will help. Please note that these pre-op exercises are exactly the same exercises I recommend for the first week post-op after the lingual frenectomy. So it's a good idea anyway to practice these exercises so that after the surgery you'll be good to go. You'll already know the exercises. So on to the exercises. They are also listed on the website and described in words at debugyourhealth.com. So the first exercise is tongue around the world. I do 10 in each direction twice a day. The idea is to close my lips and move the tongue in a circle around the teeth, around the world, or as if I'm cleaning the teeth with my tongue. So I'm going to demonstrate that twice in each direction. The next exercise is called lip lickers. I do 10 of these in each direction twice a day. The idea is to lick the tongue around the lips as if there's something sticky on the edge of the lips as far as the tongue can reach. So I'm going to do 2 in each direction to demonstrate. The next exercise is called tip pops. I recommend 30 of these twice a day. The idea is to suction the tongue to the roof of the mouth, smile, and then pop the tongue down. However, you want to try to avoid slamming the tongue against the lower jaw, or against the floor of the mouth. And you also want to make sure try to keep your jaw still so that it doesn't move. So again, tip pops. I'm going to demonstrate 10. Notice how I'm trying not to move my lower jaw, and I'm trying not to slam the tongue on the floor of the mouth. The next exercise is called peanut butter scrapes. I do these 10 times twice a day. The idea is to open the mouth wide, put the tip of the tongue onto the spot. The spot is the place in the roof of the mouth where the tongue should always be hanging out. Of course, most of ours aren't, and especially those of us that need a frenectomy, our tongue is probably not hanging out on the roof of our mouth like it should. But the spot is that spot right up on the roof of the mouth, right here, where my tongue is. You can see a picture of it on the website, debugyourhealth.com. So you put the tongue on the spot, and then you scrape it towards the back of the throat. It's as if there's peanut butter on the roof of your mouth and you're trying to scrape it off. So I'm going to demonstrate. While you're doing this, by the way, you keep the mouth open as wide as possible. So I'm going to demonstrate 5 of them. Now notice I'm keeping my mouth open as wide as possible, and I'm also trying not to move my lower jaw. It's really hard, but I'm trying not to. The next one is called tongue drags. It's the same as the peanut butter scrapes, except I'm going to suction the tongue up to the roof of the mouth. So instead of just the tip of the tongue scraping along the roof of the mouth, now I'm going to suction the tongue up to the roof of the mouth and scrape it back. So this I call tongue drags, and I'm going to demonstrate 5 of those. Notice that at the end, at the back of the throat, it makes a little pop because the suction breaks when I get to the end. The next one is I call Frenum Massage, and I do 10 in the middle and on each side twice a day. The basic idea here is to manually stretch the frenum, the lingual frenum, and I like to do it so that it's pretty uncomfortable. I like to actually do all these exercises on the border where I can feel some stretching in the frenum, and this one especially is no exception. I really try to massage the frenum. I go from bottom of the mouth, the floor of the mouth, up the frenum to the top, and I squeeze as I do it, and I just try to massage it up as high as I can. I mostly massage in the front, towards the front of the mouth, but I try to go as far back as I can. Now it gets more painful as you go back. So I'm going to demonstrate 5 on the middle, and then I'll go to the side and demonstrate that. So first the middle. I don't know if you can really see that well, but I'm going from the roof of my mouth up the frenum to the top and really stretching the tongue at the top. And then on the side, let me demonstrate the side. I try one side and I do the same thing, but only on one side. And then the other side. And somehow the side ones are actually really painful, but we really want to get that stretch in there. The last one on my list is tongue push-ups, and I hold them for 3 seconds, and I do 15 twice a day. The idea is that I hold my lower jaw in place with one hand. I try not to let it come forward. I open the mouth and I extend the tongue, and I push against this tongue depressor. I push as hard as I can against it with the tip of my tongue up against it, and I hold that for 3 seconds. So let me just demonstrate 5 of those. So I'm going to turn to the side so you can see my tongue coming out. So I hold my lower jaw so it doesn't try to jet forward. Actually, let me switch my hand so you can maybe see a little better. So those are my lingual frenectomy pre-op exercises. For more tips, tricks, and thoughts and experiences from us about frenectomies, visit the website www.debugyourhealth.com.